What is breast cancer? Breast cancer is cancer that develops in breast cell. Typically, the cancer forms in either the lobulus or the duct of the breast. Lobulus are the glands that produce milk, and duct are the pathway that bring milk from the glands to the nipple. Cancer can also occur in fatty tissue or the fibrous connective tissue within your breast. What is breast cancer awareness? Breast cancer awareness is an effort to raise awareness and reduce the stigma of breast cancer through education on symptoms and treatment. We hope that greater knowledge will lead to earlier detection of breast cancer, which is associated with higher long-term survival rates, and that money raised for breast cancer will produce a reliable and permanent cure. As a part of the member in the community, we held an event during the 12th December 2020 at exactly 8:30 p.m. with 6 members of our group, which consists of Nur Najiha binti Rizal, Farhana Hani binti Sukadari, Nur Fatnin Ayuni binti Muhammad Rahim, Saidatul Akmal binti Ibrahim, Nur Shazana Amira binti Muhammad Azari, and me myself, Muhammad Aziz bin Bakar, in a Q&A session through the platform of Google Meet with a special guest who is Madam Sham Suryati Teti Muti.
Hi, Assalamualaikum. So my first question is, what are the symptoms or signs when you have breast cancer?
Okay. Firstly, we can feel a lump or thickening at our breast at the surrounding skin. Then, we noted the changes in the size, shape or appearance of the breast, especially the color, it turned to redness. Then, changes to the skin over the breast, such as dimpling like an orange skin, a newly inverted nipple, peeling, scaling, crusting, or flaking of the pigmented area of the skin surrounding the nipple or breast skin.
Okay, second question. What are the causes of breast cancer?
Okay, there are many causes of breast cancer. One of them is increasing age. The risk of breast cancer increases as we're getting older. It's much related to hormonal changes. The most important causes is related to family history of breast cancer. If our family members was diagnosed with any types of cancer and especially breast cancer, our risk of breast cancer is increased because we inherited the cancerous gene in our body. Next is unhealthy lifestyle, such as eating unhealthy food and may contribute to obesity and impact of sedentary lifestyle. We must know that being obese increases our risk of breast cancer. Smoking also contributes to breast cancer. The component in the cigarette can activate cancer cells. Lastly is drinking alcohol. According to the National Cancer Institute, studies have found that women who consume alcohol have a higher risk of breast cancer than those who do not.
Okay, my question is, what can we do to reduce the risk of breast cancer?
Okay, how we can reduce the risk of breast cancer. Healthy lifestyle is the key of reducing cancer. Take a healthy food based on food pyramid and calorie requirement. Avoid oily food, especially fast food. Drink enough plain water instead of carbonated drinks. Secondly, quit smoking or avoid to become passive smoker. Stop taking alcohol. If you continue smoking and drinking alcohol, it will increase the risk of developing breast cancer. Third, control your weight and be physically active. Exercise 4 to 5 times a day with duration 30 minutes is optimum. Being overweight or obese increases the risk of breast cancer. This is especially true if obesity occurs later in life, particularly after menopause. Your BMI should be 18.5 to 24.9. In addition, breastfeeding might play a role in breast cancer prevention. The longer you breastfeed your baby, the greater the protective effect.
Madam, how is breast cancer diagnosed?
All right. Every woman should perform breast self-examination every month. If you feel a lump or any breast changes, then you must go to see doctor immediately. Doctor will do clinical breast examination. Your doctor will check both of your breast and lymph node in your armpit, feeling for any lump or other abnormalities. Secondly, breast ultrasound, diagnostic mammogram, and magnetic resonance imaging. Those are type of scan that will turn into detailed picture of area the breast for doctor use. Thirdly, biopsy. This is a test that removes tissue or fluid from the breast to be looked under the microscope and do more testing.
Okay, madam. Next question. As we know, there are treatment for the breast cancer. So, what are the treatment for the breast cancer?
Okay, the treatment are given based on stages of breast cancer. There are many types of treatment.
Can you tell us more about the treatments?
Yes, sure. First is drug, used to treat breast cancer. Chemotherapy use drugs to kill cancer cell. You take the medicines as pill or through an intravena. Most people get it after surgery to kill any cancer cell left behind. Doctor also prescribe it before surgery to make tumor smaller. Chemotherapy works well against cancer, but it also can harm healthy cells. Secondly, surgery. For most people, the first step is take out the tumor. An operation called lumpectomy removes only the part of your breast that has cancer. It's sometimes called breast conserving surgery. In a mastectomy, doctor remove the whole breast. Third, radiation therapy. This treatment uses high energy waves to kill cancer cells. Most women under age 70 who have a lumpectomy get radiation too. Doctors also might recommend this method if the disease has spread. It helps destroy any cancer cell that the surgeon couldn't remove. Radiation can come from a machine outside your body, or you might have tiny seeds that give off radiation placed inside your breast where tumor was. Then, hormone therapy. Hormone therapy uses drugs to prevent hormone, especially estrogen, from fueling the growth of breast cancer cells. The medicine includes tamoxifen. Lastly, immunotherapy. Immunotherapy uses your own immune system to target cell. Example of drug is atezolizumab. Patient might get chemotherapy, hormone therapy, or targeted therapy along with surgery or radiation. They can kill any cancer cells that were left behind by other treatments.
That's a new knowledge to us. Thank you for the explanation, madam.
Yeah, you are welcome.
Thank you for this explanation. This is a new knowledge for us, and I hope this thing will aware all of the women in this world. Thank you, madam.
Thank you, madam.
Thank you.
Madam.
Thank you, madam.